Hi, my name is April Berry Fletcher, and I am the director of the Masters in Social Work program at Lesley University. And I thought I would take a little bit of time today to talk about social work in general and the social work program at Lesley. And I wanted to give a little background of what social work is. And I thought the best way to go about doing that would be to discuss how social workers are responding to the COVID-19 crisis. So the best place I can start is with advocacy and policy. Social workers have been hard at work with policymakers, legislators, to advocate for policies and programs that will help our most vulnerable social members to get through to the best of our collective abilities this public health crisis. In many respects, social workers help individuals to cope. We use mindfulness and motivational interviewing and a lot of strategies to help individuals to cope and manage day to day. We also work with couples and with families. We run groups. We also work at the organizational level and then at the social policy level as well. So at the policy level, we have really pressed for services for the homeless. Friends of mine who work for the Boston Coalition for the Homeless have been able to secure additional resources, medical resources, medical tents set up throughout Boston. Other folks that I know from the National Association of Social Workers have advocated vociferously with the insurance companies to ensure that individuals who are on Medicaid, Medicare, and those with commercial insurances are able to continue with their existing providers. There was a big challenge with that because many insurance companies either do not pay for telehealth at all or pay at a different rate. And another issue was co-payments, that a strange little clause, which is that if you are seeing a provider, they are legally obligated to collect the co-payment. And where many vulnerable folks do not have access to electronic banking, this was a hardship that would preclude or prevent folks from being able to see the providers with whom they were accustomed. And this would be a disruption that would be incredibly unhelpful at this terrible time in our history. So it is these kinds of initiatives, this awareness of need, this awareness of individuals and families and the context in which we all exist. These social structures, such as insurance, such as housing, housing policies, access to medical care. These are the areas that social workers are committed to helping others. And I am looking forward a great deal to meeting our inaugural class of incoming social workers. It's a very exciting time to be a social worker, to really be able to make a difference and to serve others who are vulnerable at this time and at other times of need, but particularly in these moments, it is very satisfying to know that this situation may drag on for a while, and we will be recruiting students who will become committed, effective social workers and who will serve others who are in need. So I thank you for watching, and I wish you and your family the best of possible health in this time. Take care. Bye-bye.